So Kathy, were you going to make some early remarks?
Yeah.
Okay.
Yeah, I'm just trying to make sure that I don't have a lot of feedback. All right. See there, it did it just then. So there I go. I managed to do that every time. Okay. Well, I'm gonna kick this off and introduce and just welcome and introduce the moderator. And I want to say welcome to all of you. I'm so excited to have such a fantastic turnout tonight, and we'll continue to let people into the room as they show up. We did have, appears to be a little bit of technical difficulties with the link that people were coming into the meeting with, and we apologize for that. I want to introduce this as one of our several educational forums that we've been holding to try to highlight, understand the issues that exist for people and for Alabama, to show how people could make a difference if they participated, engaging with their elected leaders, with the government, and with actually going out and voting. And so this is one more area that we feel like we really need to understand better. And I appreciate Dana Ellis for being the moderator for it. And so she's going to introduce the panelists tonight. Before she takes it, I wanted to mention that we've got another forum. Tonight is Healthcare in Alabama. Your vote can make a difference. And we've got a fantastic panel tonight. Next week on September 22nd, we have another healthcare related forum, which is related to reproductive health in Alabama. And the topic is focused on the legal landscape. And so we've got 3 lawyers that are going to talk about the issue of reproductive health for Alabamians, and what the recent overturn of Roe v. Wade means to people who are needing to get health care. And so with that, we'll drop a link so that you can register. If you haven't already registered, please do. We'll send out a reminder after the meeting just to give you the link so you can sign up if you haven't already. And with that, I'm going to hand it off to Dana.
Good evening, everybody. Excuse me. My name's Dana Ellis. I live in the Birmingham area, and I am really delighted to see people from all over the state. Thank you so much tonight for joining us. Our topic tonight is healthcare in Alabama, and in preparation, the speakers tonight have far more expertise than I do, but I thought it might be interesting. Over the last couple of weeks, I've jotted notes down whenever there's been something in the news media related to healthcare in Alabama, just little bullet points that I thought I would share just to get us started. We know that health outcomes in Alabama are some of the worst in the nation. But one of the things that was recently in the paper is our maternal mortality rate. The national maternal mortality rate is 17.4 per 100,000 people. In Alabama, our rate is 36.4 per 100,000 people. So more than double the national rate of women who died in childbirth or in the peripartum period. Black women in Alabama die, Black women in the United States die of cervical cancer at 1.5 times the rate of white women dying to cervical cancer. However, in Alabama, Black women die at nearly twice the rate. So nationally, it's 1.5 the rate. In Alabama, it's twice the rate. There was a recent article in the last 2 weeks that the percentage of Alabamians under age 65 without health insurance increased to 11.8% in 2020 from 2019. So that in 2020, 461,000 of our fellow Alabamians below the age of 65 did not have health insurance. The rates of diabetes and hypertension are very high here compared to other states. I saw one statistic, the diabetes, we were number 2 in the nation. So we face a difficult landscape. And tonight we have 3 excellent speakers to talk on this problem. We're going to start first with a topic that we've all heard about for the last few years, which is COVID. And the Poor People's Campaign produced a report maybe close to a year ago, Shelly, correct me if I'm wrong, that I've invited our first speaker to discuss with us because it's got extremely important information for us to know. Shelly Barnes is the policy director for the Poor People's Campaign, a national call for moral revival, and the Kairos Center for Religions, Rights, and Social Justice. She has a background in law, economics, and human rights, and has spent nearly 20 years working with and for poor and dispossessed communities. Tonight, Shelly's going to go over the report for us. I will ask the group, my plan is to hold questions till the end, which I would appreciate. You can write them in the comments as we go along. It might be better even to wait to write them till the end so they don't get lost. But for now, thank you, Shelly, so much for joining us, and I'm going to turn it over to you.
Thank you, Dana and Kathy and everybody who's on this call tonight and everyone in Alabama who is doing so much work to change the conditions that you laid out just a minute ago. It has been a very tough couple of years in this country, in the South, in Alabama, between the pandemic, this inflationary crisis, assaults on democracy and reproductive rights. It's just one thing after another. And I will talk about this report, the Poor People's Pandemic Report, that we put out actually just earlier this year. But I wanted to say for a minute that everything we're facing right now, it didn't happen out of nowhere. It's the consequences of decisions, policy decisions about how to allocate our resources, decisions about who has access to food and housing and healthcare and who doesn't. So I'd like for us to keep this in mind, because if these are all the result of decisions and policy choices, then we can make different choices. That's what we're organizing for in the Poor People's Campaign. I know that's what you all are doing in the League of Women Voters and across Alabama, organizing for different choices, both as we head into these midterm elections and beyond. So let me say a few words about this pandemic report and why we did this. What we had been seeing in the Poor People's Campaign was that we saw a lot of numbers on the pandemic and on COVID, in terms of COVID and race, but we actually weren't seeing a lot that put COVID, race, and income or poverty together. The CDC was not putting out these numbers. And what we were seeing on the ground was, entire families, generations within families just wiped away. Some families had lost, 15, 20 members of their loved ones, and communities were just being devastated between this massive loss and then unemployment and just crisis upon crisis. There's also all kinds of community support and mutual aid that was emerging in response. New food distribution programs, housing support, childcare. Some indigenous tribes decided that they could take better care of themselves than the government would, and they started providing their own health care on the reservation. So we wanted to understand all of this together through this framework of health, COVID-19, race, and poverty. And we worked with a network of economists and statistical experts to quantify what we were seeing at the national scale. And so what we did was, working with this network, the Sustainable Development Solutions Network, we looked at all 3,000 counties in the country. And across these 3,000 counties, we looked at a bunch of different factors. We looked at race, we looked at income, we looked at COVID-19, death rates, poverty, we looked at uninsured status. And we put together a dashboard, which I'll share in a minute, where you can look up your county's information on all of this and see how it compares to other counties. But just as an overview, what we found was very dramatic and in many dimensions, much worse than we thought it would be. Poor counties had an average of twice the death rate of richer counties. So people in poor counties were dying, or the counties that had a higher degree of poverty had 2 times the death rate of wealthier counties. And when we looked at the pandemic in different phases, we saw that at different times, that death rate was up to almost 5 times higher in these counties, in the poorer counties. And actually in the earlier phases, the first phase of the pandemic was experienced mainly by higher income groups, which makes sense. These were the people who were, traveling the most and that kind of thing. And then when they came back home and, things were spread to other segments of society, the later phases, Omicron and the deadlier phase in the winter of 2020 were almost mainly experienced by poor and low income groups. And so we took a closer look then, and we looked at the counties, the 10%, the 300 counties that had the highest death rate and the highest poverty. And it's probably no surprise to anybody on this call, they also had a higher percentage, a disproportionate percentage of people of color, especially Black, Hispanic, and Indigenous people than you would expect. So what all that means is, if you're looking at 10% of the counties in the country, you'd expect that those 10% have about 10% of Black people, 10% of Hispanic people, 10% of Indigenous people across the country. But these counties had, accounted for 30% of all Indigenous people in the country live in these 300 poorest counties. We also saw that on average, half of the population in these counties was white. The uninsured rate was twice as high in these poorest counties with the highest death rate. More than half of them were in states that did not expand Medicaid. So this was, these are some of the national findings that we saw. And to be very honest, it was a very emotional, difficult report to work on. I was in tears actually for weeks, because you could just see this reality of the choices that have been made for poor and low-income people in this country, choices we would never make for ourselves, choices we would never make for our own communities, but that have been made for them. And it's all unnecessary, the suffering. So I wanted to share my screen for a minute and show you where you can find this information and how then we can use it. So if you look at the overall report, you can find, I'm just scrolling up, sorry about that, at the Poor People's Campaign website. If you go to the poorpeoplescampaign.org, you go to the Learn tab and click on Poor People's Pandemic Report, this is what you'll see. And the pandemic report had a couple of different components to it. There's a summary of it right here that shares some of these numbers that I just was talking about. Then there's this really powerful story map, which has a bunch of different graphs and maps, and you could see the different phases of the pandemic, a bunch of different information. It has some snapshots, some local stories where we looked at one county's experience and put that into relationship with the national picture. And if you go through the story map, underneath the story map, there's this interactive county level map. And so if you click on this map, it takes you to another window. And this is what you see when you pull this map, when you click on it. And so on the one hand, you see these 300 counties on the left, has a bunch of information. So here, one thing that we found is a lot of these counties with high poverty and high death rates are small rural counties. And counties that had, smaller populations, they weren't counted in some of the bigger numbers that were produced by the CDC. And so a lot of this kind of got, it was made invisible. But right here, you can see these are the top 300 counties on the left. You can actually click on any part of the country and then go deeper, zoom closer and closer in on these numbers. I just entered Alabama up here in the state list. So I put in Alabama. And once I put in Alabama, you could see Alabama's highlighted over here. And then you can go into your county. And so maybe I'll start with Jefferson, or we can do Lowndes County. Look at Lowndes County, Alabama. And it zooms in on Lowndes County, Alabama. And what you can see, once it's zoomed in there, it takes a second to load because there's a lot of information here. What you can see is if you just click on Lowndes County, you should get a, oh, whoops, sorry about that. If you click on it, it should pop up a bunch of information about Lowndes County. So maybe it'll just take a minute to load. And folks who are maybe doing this on your home computer, following along, maybe it's coming up for you. Let's see. Okay, here we go. So it's loading. And so you can see in Lowndes County, and this is all of this data is updated as the back end statistics, the back end data, which is all coming from national databases, is updated. So this is very current information. So in Lowndes County, Alabama, there have been a total of 69 deaths from COVID. The death rate is 700 per 100,000. Now this is, I believe this is at least twice the death rate of the country as a whole. It shows you the median income in Lowndes County is about $30,000. It shows you the percentage of people who are living under twice the poverty line. And we use that measure. So more than half of Lowndes County is living under twice the poverty line. And we use that measure because the poverty line, as some of you may or may not know, it's a really low measure for a household of 4 people. It says that if you're earning about $30,000, $31,000, then you're not poor. Well, I have a household of 5 people, and I can't imagine. I mean, living on $30,000 would be very difficult, and even living under twice that, $60,000, is very difficult. And so, you know, we double that number, and we see, you know, almost more than half of Lowndes County is living under twice this poverty line, is poor, or as we say in the Poor People's Campaign, poor or one emergency away from being poor. It gives you the uninsured rate. Again, this is a much higher rate than the rest of the nation. And then it also gives you some of these other statistics. People who are housing insecure, meaning they're paying more of their income on rent than is recommended to actually be able to sustain, you know, some economic security. And almost 3/4 of Lowndes County is housing insecure. And then we also looked at the police violence rate, 21 deaths, again, higher than what's average in the country. So if we can go into any county, you could put in Jefferson County, you could put in, you know, Montgomery, you could put in, you know, your county, and look at all of this information. And why this matters right now is that, you know, we're heading into the, I mean, it matters because we need to know all of this information, first of all, but we're going into these midterms, right? And there's been a lot of action on in the national news, you know, with this Build Back Better agenda. There's been a lot of relief going to a lot of different people. There's really been very little on housing. There's been no increase in the federal minimum wage, no expansion of Medicaid. And even after Roe was reversed by the Supreme Court, really no action taken at a federal level to make sure that women have access and people who are pregnant have access to the reproductive care that we need. And, you know, poor people basically still aren't centered in our nation's policies. And so right now, the conditions that brought us to the pandemic, and you all know this in Alabama, you know, where hundreds of thousands of people don't have health care. You had a city council that passed higher wages, but then your state said no. You had a trigger ban passed right after the Supreme Court decision, and a trifecta in your government that says, you know, that kind of can make a lot other decisions that hurt poor and dispossessed people. So, you know, again, these are challenging conditions, but they can be changed, because also in Alabama, you have a lot of poor and low income voters. There are 1.9 eligible poor and low income voters in Alabama, people who share these same conditions. Only about 1 million of them voted, but even that million, they accounted for almost half the votes that were cast in the 2020 presidential election. There's this huge political potential to change what's politically possible. And so I'll end that, as we move towards November, towards these midterms, remember that the issues that matter most to nearly half of the voters in Alabama are health and economic well-being. You can use this information of this report to reach out to different communities, talk to them about how they're doing, and unite these voters around these issues to change what's possible in Alabama and change what's possible in the rest of the country. Thank you so much.
I forgot I was muted. Excuse me. Thank you so much, Shailly. And I did put a link to the report in the chat box. I really encourage people to dig into that report. As Shailly said, it was devastating information to know that policy decisions resulted in so much death in our state as well as others. As we talk about healthcare, it's always, I think, important to hear the voices of people who've been most directly impacted. And I am honored to be able to introduce y'all to Callie Greer. Callie is a resident of Selma and has been a community advocate for more than 20 years. Initially propelled into this work by the death of her son due to gun violence, the intensity of her work increased after the death of her daughter, and she's going to tell us about that. She works with Alabama Appleseed as a community navigator and is deeply, deeply involved with the Poor People's Campaign on both the national and the state level. I've had the distinct pleasure of knowing Callie for a number of years and hearing her speak on several occasions. One of my favorite times was watching Callie present to the House Budget Subcommittee in 2019. If you want a demonstration of speaking truth to power, you can find that on YouTube. But let me not take any more of Callie's time. Callie, thank you so much for being here tonight.
Thank y'all for having me, Dana. Good evening, everybody. It's an honor to be here. I won't say it's a pleasure because of the topic, but thank you nevertheless for welcoming me into this space of powerful, concerned people. I've shared my story so many times that every time I share it, it's different. And sometimes are easier. Sometimes it's compounded. And tonight it was sort of compounded as I was listening to Shelly share about all of the other loss of these families that lost 15.
Uh-oh. I wonder if, let me just check, Callie may have lost internet connection. Yes, she has dropped off. And I hope she will be able to reestablish soon because hers is a powerful story and a powerful voice. But since we don't know how long it might take for her to come back on, let me introduce Jane Adams, who was originally going to be our third speaker, but we'll have Jane start now, and then Callie can tell her story if she's able to reconnect. Jane Adams works with Alabama Arise as the Cover Alabama campaign.
Callie's coming back in.
Oh, okay. Sorry, Jane. We'll hold just a minute.
That's okay. Callie's better. So
no, everybody's good tonight, but I'm so glad you're back, Callie. I think you're here.
She's coming back on, I think.
Okay, cool.
My laptop just I don't know, it just shut down.
Okay, well, welcome back.
Yeah, I am in rural Dallas County in Selma, Alabama. So as all the times that it was shut down. But as I was sharing, it is I have been like, it's heavy sharing it tonight because of all of the other families that are sharing the grief of loss that was in some ways preventable. We did not have to bury our loved ones. I usually I say to people that it was different with my son Mercury, because once the gun was fired, the bullet was hit him, it was done. But for Venus, it was different. Venus, was going to the emergency room because she didn't have healthcare insurance, complaining about a small knot in her breast. And they just kept turning her around and telling her it was nothing, giving her medications and so on and so forth, until her last visit to that emergency room. When the doctor entered the room, there was a odor in the room, and he just asked, "What's that?" And Venus lifted her blouse, and it was her breast, which was literally rotting. And that's when Venus got some help. They sent her to the cancer center. She was in 4th stage cancer, breast cancer. Within 2 weeks, they had scheduled her for radical mastectomy. She went through chemo and radiation. She was in remission for about 6 months. When she went back for a follow-up, the cancer had spread throughout her whole body, on her lungs, her bones, everywhere. Even with that, when the oncologist would give Venus prescriptions or tell her she needed certain medication, we would have to literally go through all of this different, not just black tape, red tape, green tape, all kinds, to get the medicine that the doctor is saying is going to sustain her life, give her some comfort. And I mean, literally, they just let my baby die. And during the last part of her cancer, she was waiting for oxygen tanks because the cancer had spread it to her lungs, and for a CAT scan. And it took about 6 weeks for her to get the oxygen tanks. During that time, my husband, who's sitting here, would have to literally carry our baby to the house, through the house to the bathroom. And it was very, very, yeah. So the Friday before Venus passed, she came to the house and she said, "Mama, my head is hurting me so bad that I can hardly see." And so we rushed her to the cancer center, who sent us to the emergency room. And when we got there, they took her right to a room, and we talked to her for a while. And they took her out for the CAT scan she'd been waiting for. And when we brought her back, she lapsed into a coma. And the finding was that Venus had 2 tumors on her brain, and one had ruptured, and she was brain dead. We prayed about it, and we, went back the next day and decided, because I just really couldn't deal with the machine, because she was already gone, breathing for her. And we all had our words with her, and we unplugged the machine, and she was gone instantly. At Venus's going home service, when I charged people that were there to become a part of the expansion of the Medicaid, because I truly believe that my baby should be alive, that she should not have died because she did not have healthcare insurance, because she didn't have this plastic card. Her life was valued at nothing. And it's just, it never grasps in my mind that in America, we allow our loved ones to die for lack of healthcare insurance. It should not happen. It should not happen. I believe it's a heart issue. It's a spiritual issue. When we don't care enough for humans to want them to be healthy. How can we vote against something like that? When we will not, most of us would not even want to take a job unless we had to, without these kind of benefits. So thank y'all for listening to my story. If hearts were not in that place to support healthcare and Medicaid expansion, I hope that this this story about Venus has moved you to become a yes person for Medicaid expansion. And if you were already there, I hope this has infused you to make other people understand that we're not only talking about numbers and statistics, we're talking about children, husbands, wives, nieces, nephews, loved ones that do not have to die. Thank you.
Callie, thank you so much. I'm in awe of your courage and your bravery and your honesty. And thank you very much for talking with us about Venus tonight. And I hope everybody will join me in saying Venus's name. Venus.
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 That's right.
Venus. Rest in power.
That's right.
Thank you, Callie.
Venus.
Thank you, Callie. So much.
Venus.
So thank you, Callie, so very much. Y'all, that was such an important message for us to hear. And I'm very, very, very grateful to Callie. Now, our next speaker is Jane Adams. Jane is the Alabama Arise Cover Alabama campaign director. She's a 9th generation Alabamian and lives in Huntsville with her husband, daughter, and dog. She has a master's degree in theological studies from Wesley Theological Seminary in DC, where she studied the ethical implications of public policy. And it struck me as I read that that's what we're talking about tonight.
Yeah.
Callie brought it up, and
Yep.
that's what you studied, the ethical implications of public policy.
Yeah.
So Jane joined Arise in 2020, and she's going to share with us some more information about healthcare in Alabama and the Cover Alabama Coalition. Thank you so much. Jane is in DC tonight, if I understand that right. So I'm really grateful to her for joining us.
That's true. I flew to DC this week for a conference and had some really good meetings today, but I'm honored to be here. I've been looking forward to it all day. To be in a virtual room full of people who are showing up because they believe in a better Alabama and a better future for Alabama. And they believe things like healthcare is a human right, like Callie shared so passionately about her beloved daughter, Venus. I'm going to share a little bit about the state of healthcare in Alabama, but as you've heard from the other testimony that's been shared here, it's not great. It's pretty bad. And that impacts all of us, whether you have health insurance or not. So I'll just go ahead and start with some numbers, and then I have a short video I want to show you that hopefully will kind of compel you into seeing this every day, not not seeing it when you just join a webinar or when you're talking with a lawmaker, but making it a daily practice to see the Medicaid coverage gap in Alabama. So why were phenomenal women like Venus in a situation where they couldn't afford to go to the doctor or they didn't have health insurance provided by their employer, and cancer metastasized, and even doctors rejected, following the right pathway forward for care, perhaps out of a concern of cost. It pains me to say this because I have a brother who is in the Medicaid coverage gap in Alabama. He's been in and out of it for the past few years. Some years he qualifies for private health insurance, other years he falls into the gap. And I think about the fact that if Venus would have lived in Arkansas or, West Virginia, Kentucky, Louisiana, that she would have had health insurance provided to her that could have prevented her cancer from progressing to the stage it was. If my brother lived in Arkansas, I'd never have to worry year after year, if he would finally make enough to qualify for health insurance. I would just know with certainty that he would have health insurance no matter what his income is. And that's because states like states like Arkansas, Kentucky, Louisiana, West Virginia, 38 states, and I just named some of our neighboring ones, but 38 states have expanded Medicaid. They decided to opt into Medicaid expansion, which essentially meant that everyone, no matter what their income was in their state, would have access to quality, affordable health insurance, either through Medicaid or through the private health insurance marketplace. But Alabama did not do that. And we're one of 12 states that has not expanded Medicaid, which means there are an estimated 300,000 low-income adults in Alabama that have no health insurance. Most of them are working part-time jobs, gig work, and I'll get into that in a little bit. Many of them are parents. Some are college students. Some are older adults. Some are single folks, just, grinding it out one day from the next, from one job to the next. Some are grandparents, who haven't reached Medicare age and are at home taking care of grandchildren. They're all around you, and you interact with them every day, individuals who are in the coverage gap. And many of them don't even know why they don't have health insurance. Explaining healthcare policy just kind of like sends, it goes over the head for a lot of people. And I don't envy them because it's a corrupt and difficult system to navigate in our country. It's really inherently based on money and markets, not based on quality of care and accessibility. And that's the system that we have, but it doesn't have to be that way. Our elected officials can make the decisions. Governor Ivey or the governor, legislature can make the decision to expand Medicaid in Alabama at little to no cost. In fact, in the first 6 years, they would actually save money from expanding Medicaid. It is truly affordable. It is not a big budgetary item. And not only is Medicaid expansion just ethically the right thing to do, right? Our bodies are our beings. We aren't anything else. When we are injured or sick or hurt, we are injured and sick and hurt. Our personhood is, and that sometimes results in death, our lack of personhood when we can't get the care that we need. Our system isn't based on the ethics of that. It is really based on a mentality of haves and have-nots, but that isn't the way that it is. And I think I just want to get across it. You're being deprived of something that your tax dollars are paying for. Every time you cut a check to Uncle Sam, you are paying for Medicaid expansion in Hawaii. You're paying for Medicaid expansion in California. You're paying for people like Venus to get the care that they need in Ohio, right? Meanwhile, the Venus down the street from you can't get the care that they need. Your, niece or nephew can't get the care that they need. Your sister or brother can't get the care that they need. And that is purely a political decision. Cover Alabama, the coalition that I lead, is a nonpartisan coalition that believes in quality, affordable health care for all Alabamians. We have 118 coalition partners, and we are actively advocating for the state of Alabama to expand Medicaid, not only because it's good for, quality of life for individuals and because it's a human right, we believe, but also because it is a huge economic driver in our communities. Expanding Medicaid is one of the only things our state government can do that would provide jobs in every single county. It is, in fact, the only thing our state government can do that would save rural hospitals that are at risk of closing. If we do not expand Medicaid, more rural hospitals will close. I guarantee it. And I guarantee it because people who are very, very sick and have not gotten treated in a long time end up going to the emergency room. And if they don't have any health insurance or any way to pay those medical bills, which they don't, we know that based on the data, that means that becomes uncompensated care. that the state has to pay somehow to the hospitals, essentially pay them off, you know? We don't have to do that system anymore, where we pay the hospitals the debt of not having preventative health insurance. We can instead invest in preventive health insurance that would lead to saved lives, people able to stay with their families, their children, their brothers and sisters, not die prematurely. People who would be able, like my brother, to get access to mental health treatment for the first time in his life, and medication that will help him with his anxiety and PTSD from being, you know, in the EMS and, you know, working on ambulances. That health insurance saved his life. It gave him the ability to be a, you know, productive citizen of Huntsville. He has a full-time job now and is able to work. He quit smoking cigarettes. I mean, I saw firsthand the benefit when he was able to afford health insurance. And so I kind of want to talk to you about those people, because, you know them, and I bet you can think of them if I gave you a minute to, and in a minute I will. But I want to kind of talk a little bit about what the coverage gap is and who is in it. So in Alabama, our Medicaid eligibility is extremely stringent and bare bones. The only other state in the United States that has a worse Medicaid program is Texas. Now, Medicaid and Medicare are very different from each other. Medicare is an entitlement, which means that no matter what your income is, when you reach the age of 65, you get a Medicare card in the mail that allows you to be able to see the doctor at an affordable price. That has its own set of benefits with it. Medicaid, there is one Medicare program in the United States. There are 52 actually, if you count Puerto Rico and Guam, Medicaid programs in the United States. And that's because Medicaid is inherently, at its creation, a partnership between the state and the federal government, where the state sets the eligibility and the federal government helps fund Medicaid. Now, I could get into all of the racist reasons why Medicaid is the way it is, but I'll just give you a brief spoiler, like a little trailer preview of it. Is Medicaid and Medicare were passed together, and they were passed by Lyndon Johnson and a Congress that was dealing with, reversing Jim Crow and moving towards civil rights, but still wanted to, still inherently racist. And that's how you see a Medicaid program where states determine the eligibility. It's no surprise to me that the same states that have not expanded Medicaid were the same states that fought for Medicaid to be a state-run program and not a federal program, not an entitlement like Medicare. So it's incredibly stringent. What I mean by that is that in Alabama, a family of three has to make less than $3,910 a year, not monthly, a year, for the parents in that family to qualify for Medicaid. So $3,910 a year for two parents and a child. The child will qualify for all kids, but the parents, if they make anything more than $3,910 a year, up to $22,000 a year, which is when they can start receiving subsidies to get private health insurance, they are in the coverage gap, meaning there is no way for them to access affordable health insurance. In Alabama, there are 50,000 women who are working but are still trapped in the coverage gap. Many of these women are working in restaurants and grocery stores and childcare and in the hospitality industry. You know, I noticed at the hotel that I'm staying at, the maid who was cleaning my room, I was speaking with her. She has health insurance. I'm in Washington, D.C. She has health insurance. And she doesn't have to worry about health insurance. It's just there, provided to her, no matter what her income is. Whereas when I go to Montgomery, I ask and stay at hotels there, I ask the staff, and every single one that I've asked has been in the coverage gap. They don't work enough hours. They don't work 40 hours a week. They occasionally work 29, 28. They aren't paid enough to to be able to qualify for that subsidy, and their employer does not provide health insurance for them, which means they're in the coverage gap. And if we expanded Medicaid, they would have health insurance. Expanding Medicaid in Alabama is long overdue. I mean, that's like the, the statement of the century, right? I mean, it is long overdue. Medicaid expansion would ensure that nearly 300,000 low-income adults would have access to life-saving health insurance, just the access to it. We're not forcing anyone to go to the doctor. We're just giving the ability to go to the doctor without being worried if it will financially ruin them. Medicaid expansion would benefit every county. It would create savings in our general fund and create revenue in our education trust fund. And the decisions that we make on the ballot, when you vote, you're voting on health care. And I would strongly urge you to get to know your legislative candidates, the candidates that are on your ballot, and ask them about Medicaid expansion. Because yes, it is true that the governor is the ultimate decider in our state. And we're working very hard at Cover Alabama to push for her to expand Medicaid. And I will share our sign up page where you can sign up to, receive action alerts and help us with that. But your local lawmakers can influence the governor, your county commissioners, your city council members, the members of your chambers of commerce even can influence the governor in ways that I cannot. And unfortunately, and tragically, and disappointingly, Callie cannot. We're just mere people who see a problem and want to solve it. Unfortunately, there's a system where there are people in power, and the only way that we can convince them to do the right things is to hold them accountable. And that's what voting really is. I went ahead and shared the link so you can sign up for to receive some of our action alerts and our updates of when we're meeting with lawmakers. Another thing that I just want to share is that Medicaid expansion is popular. A January 2022 poll from Signal polling firm, which is the governor's polling firm that she uses in her polling. I was very smart about the one that I chose. Showed that nearly 72% of Alabamians support Medicaid expansion, including 66% of Republican voters, and over half of voters strongly support Medicaid expansion. And that's because they see it, the benefit daily that healthcare provides to them, or the lack of healthcare, how it is detrimental to their community. Perception on healthcare has changed quite a bit, but here's one thing that I can guarantee with a certainty. People vote on their healthcare. And so we have to make it known to them that the candidates that they're voting for, where they stand on an issue like Medicaid expansion. Because it's, at this point, if you care about Medicaid expansion, who you elect will make a difference. So I want to talk a little bit about the Alabamians who are in the coverage gap. And, I mentioned my brother, and Callie passionately shared the story of Venus. But these are folks that are working. They're folks that are working low-wage jobs and can't afford private coverage. They're workers who are in between jobs. They're adults who are stay-at-home moms, right? Or stay-at-home dads caring for children or older family members. Some of them are people with disabilities who are awaiting their SSI determinations. Some of them are adult college students, uninsured veterans. The list goes on. So I wanted to show just a quick video because I've been putting this practice into my life and encouraging all of our coalition partners to do it as well. But I wanted to share this video that I quickly put together and shared with our coalition last week, and encourage you to take on a task to see the Medicaid coverage gap everywhere you go. So I'm just going to quickly share my screen, and then I'll answer questions, or we can get to the question part. And that will be it for me after this video. Oh no. Oh no. Just having such a hard time. Let me see if I can.
Jane, if you want to drop it in the chat, I can pick it up,
Yeah,
play
I'll
it,
drop
and
it in
play
the
it,
chat.
and I can play it from here if you want me to.
Okay, here, let me download it and see if that works.
Just send me the link. If you have a
Okay.
link, that's all I need.
Okay.
I think that'll work because I'm wondering if your bandwidth may be kind of tight.
It's true.
The
My
hotel.
bandwidth could be difficult. Let's see here. Well, I'm gonna see if I can just keep playing it because I don't think it's my bandwidth. My bandwidth is pretty good. I think it's the video hadn't loaded all the way.
Oh, okay.
So
right.
yeah, let's see. No, you're right. It's not going to work. Oh no. Okay, so that was just a short video, but I'm encouraging you to see the coverage gap everywhere you go. When you stop at the gas station, that attendant is in the coverage gap most likely. When you go through a drive-through, those folks that are serving your food are most likely in the coverage gap. When you take your kids to an amusement park or a trampoline park or anything that requires you to spend money at some sort of park, those workers at those parks are in the coverage gap. In fact, I was just at the Birmingham Zoo last week and talked to some of the animal caretakers who are in the coverage gap. So they're everywhere. These folks are everywhere and they're working and they're contributing to our economies, and they are people, real people with parents and siblings and friends and children, and their lives matter. And it matters for you too that they have health insurance, because one thing that the Poor People's Campaign has pointed out is it is detrimental to all of us when we have persistent poverty in our communities. It is detrimental to all of us. And just a real quick note about poverty is the reason I do this work is because I want to end poverty in Alabama. And I know that the fastest way to end poverty in Alabama right now, with the political decisions that await us, is to expand Medicaid. The states that have expanded Medicaid have seen significant reductions in poverty and child poverty as well. And that's because healthcare is a part of our economy. And when you don't have it, you're being left out. You're being denied. Now, I'd love to live in a day where healthcare isn't a part of our economy, but that's not what I live in. And so now all I can do is encourage people to see the right choice, which is to choose human decency and to choose the right economic decision, which is to expand Medicaid. So I'll just pause there, take any questions or anything like that.
Thank you so much, Jane. And despite the stops and starts with the video, it was still very powerful. I think that was so well done. Is that going to be covering the airwaves? What is the plan for the use of the video?
Yeah, so the Cover Alabama campaign is in full swing. So if you join us in our efforts and you sign up for the action alerts that I put above in the chat, we are gung-ho full swing. We're doing community meetings, educational community meetings, health fairs, all across the state from October until February and March. And then we are going to be allowed loud voice at the legislature this year. We believe this is our year to expand Medicaid. Our steering committee, which is led by brave organizations like the Heart Association and the Medical Association and others, have submitted a memo to Governor Ivey outlining how we would like her to expand Medicaid and requested a meeting with her. We've been meeting with lawmakers, and we really actually, it's hard to feel hopeful, right? After seeing all of this, but I do feel hopeful because it is a positive economic decision for the state. If they don't care about the human person, which is the reason I would do this, but again, I'm not in charge, but if they care about the dollars, it is a very positive economic decision. The states that have expanded Medicaid have seen savings produced in their budget. They've seen lower mortality rates. They've seen higher workforce participation, quality of life, more revenue increase in state and local tax dollars. So there really is no reason any longer, no excuse. The governor can't say we can't afford to pay for it. That's not true. Study after study after study after study shows us exactly how Medicaid expansion pays for itself by the savings it produces and the revenue it generates.
Thank you for that. I was thinking when Shelly was talking earlier about the need that so many poor and low income voters in the state of Alabama didn't vote in the last election, and how turning out that group of people focused on issues such as healthcare could change the climate right away. Yeah. I am not seeing, I'm seeing comments in the chat, but not direct questions. However, I'm concerned that I might have missed a direct question. So if you have a question that I either overlooked there or you have one now, please unmute yourself and ask that question. And when you get a chance, look at all the great comments in the chat. But who's got a question for one of our speakers?
This is Catherine Davies. I have a question. Can you hear me?
Yes.
Yes. Hi, Catherine.
Hi. My question to you, Jane, is what arguments are used to justify not expanding Medicare? Like, what are the standard arguments they use?
Yeah, well, they're all really old and tired and out of date, but I'll share them with you. It's like throwbacks to the early 2000s arguments. They're out of date and they're not correct. They don't have the correct data. So one of the arguments that we hear in opposition is concerned that the federal government would somehow stop funding Medicaid expansion. Right now, under the Affordable Care Act, it is law, period, LAW, period, case law decided by multiple cases in the Supreme Court, that the federal government will pay for 90% of the cost of Medicaid expansion, and the state only has to cover 10%. However, some lawmakers feel as if that the federal government would go back on this legal obligation and cut that, which, by the way, has only happened when one party has been in power, and I won't say which one, but it rhymes with McClublican. Yeah, and there are things that the state can do. We've recommended to the governor putting in a trigger clause that when she expands Medicaid, that if the federal government ever goes below 90%, she could immediately move out of the program. And many states have implemented those trigger clauses, like Kentucky and West Virginia and Montana, that would allow, and their states have expanded, but they have that trigger clause in place. And I always joke with the governor's staff when they bring this concern up, is that we could join in a wonderful lawsuit with California and New York and Illinois, suing the federal government over if they ever did cut the funding, because again, 38 other states have done this. So we would be in good company if we went ahead and did it. That's one argument, and it's just not based in reality. And there are things that you can do to ensure your fiscal safety on that. Another one is that they believe that we can't afford it. The cost of expanding Medicaid and annually is $225 million. Right now, there is about $390 million that we spend on providing Medicaid dollars that we spend in our general fund that would be covered under Medicaid expansion. So for instance, in a situation like Callie's with her daughter Venus, women who are, wanting to get a cancer screening, perhaps are not covered under Medicaid, right? But when their cancer diagnosis gets to stage 4 and it's terminal, Medicaid will then step in and cover them, but they're covering them at, paying 60% of the cost. The state is paying 60% of the cost. Whereas if we just expanded Medicaid, those individuals would be eligible for health insurance that the federal government pays 90% of the cost. So we're literally, it's like we've seen all these issues in the health system with like opioid addiction and mental health and, substance use disorders and cancer and diabetes and all these problems, right? And we've just like put Band-Aids over them with state dollars over the last 10 years. And those state dollars adds up. And it's $390 million of our own state dollars in the general fund that are paying to kind of Band-Aid a broken health system because we haven't expanded. And if we expand, instead of spending our own tax dollars on it, we'll still be providing those services where no one's cutting any services. Instead, the federal government will cover 90% of the cost. So I explain that to leaders like Greg Albritton in the Senate and other folks, and they'll say, "Oh, that's funny money." But it is not funny money. It's just economics and how things get paid for between state and federal governments. So that's an excuse we hear, is we can't afford to pay for it. Another excuse that we hear is these people aren't working, right? We don't want to create a welfare state. Well, that's also not true. The vast majority of people who are in the coverage gap are working, and those who aren't working, we know from very good studies that many of them are staying at home with children, taking care of elderly parents, in between jobs, doing gig work. And then some of them are college students or, have retired early and don't qualify for Medicare. So it is just not true to say that, this would be lead to more welfare. That's just not even accurate. But lawmakers will occasionally claim that. In fact, in all of the studies that we have, and we have many, right? The Medicaid expansion has been existing for a decade in 38 other states. We have many studies that show that it increases labor force participation. It doesn't decrease it. So those are the lame excuses, tired, old excuses I get. And I used to entertain them, but now I just really don't anymore. I require people you have to show me data if you want to be able, I'm having a conversation with real numbers and facts here. I've done my research. I've read my reports. I've studied every Medicaid expansion program in the state. I know what I'm talking about. The people at our medical association and others, the folks who are advocates, we know what we're talking about. And if, any lawmaker who wants to have an honest dialogue, and the ones that I have had with have ended up supporting Medicaid expansion. So if anyone, I think that there's just a genuine lack of, they don't want to actually know the reality, but we have to face them with it, and we have to keep facing them with that reality. It's my job to do that, and our job as voters. So,
thank you, Kathy. I'm Kathy Jane. I was thinking of Kathy a minute ago. Other questions?
Yes, this is Richard Alexander. I had a question. I know they were talking about putting in a work requirement, which was really insane because you're talking a 20-hour-a-week work requirement. And at that point, even though Alabama doesn't have a minimum wage, anybody working at the federal minimum wage would make too much money if they worked 80 hours a month. Right. Because in addition to the 80-hour requirement, then they would also have that 3,900 or 3,000 whatever for a family of 3. Did that ever pass? I saw them talking about it, and I was just shaking my head.
That never did pass, thank God. And that is because some other states have tried to move forward with the work requirement before Alabama did. Specifically thinking of Arkansas, they tried to put a work requirement on their Medicaid expansion program, which was already existing. They had already expanded, but tried to put a work requirement on it, and just kind of, I don't know, I guess they want to spend money on a useless lawsuit, but the Supreme Court fortunately ruled that Medicaid is not a work program. So you can't tangentially link the benefits of Medicaid to one's employment. There are things you can do to encourage work, and there are things you can do to incentivize work. And those are conversations we would welcome to have with Governor Ivey. But if she wanted to move forward with a work requirement, I mean, we would have to look at the language of it, but it's not an authentic effort of trying to expand Medicaid. That's a poison pill, and the federal government will not approve that. President Biden's CMS has already made that clear, and the courts have already decided on that. So frankly, we're not hearing the governor suggest anything. Yeah, around work requirements.
Sorry.
She's looking more into work incentives right now, and we're trying to encourage her to go in a good policy way, not a bad policy way on that.
Oh, I had a question for Shailly. This is Kathy. I was watching a program, and I will admit I watched John Oliver, but he had a program on environmental racism, and there was an organization out of Louisiana that had done a study, and it appears to have just been limited to Louisiana, but it seemed like there was just a very evident correlation between zip codes and where environmental waste dumps, and also just basically, where pollution, was, people were dumping stuff. And I know that Alabama is a home rule state, so there's a lot of places where there are dumps that the cities have no choice. They can't, reclaim it. But I was just wondering if there was any kind of consideration of connecting the dots between the healthcare analysis you've done along with the environmental racism, because to me it just seems like trying to tie those dots together. I was just thinking, I was asking Shailly, but I'm guessing it's probably something you guys are all looking at.
Yes, for sure. I mean, in the agenda of the Poor People's Campaign, we talk about both the right to health and the right to a healthy environment as part of the same set of demands, right? We can't talk about. It's one of the reasons we talk about ecological devastation, and human beings are part of this ecology, and why we can't, again, talk about this without also then including racism and poverty and all of these things together. So this is definitely, our orientation. And I think if we did do a closer look at those 300 counties that had the highest poverty and the highest rates of COVID, first of all, when we look at those counties, as I mentioned earlier, you do just see this over-representation of Black, Brown, and Native people in these counties. And then, you could layer factor on top of factor from there, whether it's, half of those counties, more than half of them have not expanded, are in places that haven't expanded, or in states that have not expanded Medicaid. Then we weren't able to kind of gather enough data at a county level everywhere to look at, for instance, water affordability or some of these other factors that you could layer on top. But, again, if we were going to go into a county by county assessment, or just look at these patterns, you could lay that map. You could lay a map on water affordability. You could lay a map on infrastructure, disinvestment. You could lay, you could overlay a bunch of information, and the same parts of the country would kind of emerge. And these are going to be places where there is this overrepresentation of people of color. There is an overrepresentation of poor people, and in fact, most of this fossil fuel that's responsible for the devastation in Louisiana, whether it's a Cancer Alley or the destruction of the mountains in West Virginia, all of that, so much of that is going to support military endeavors around the world. And in fact, our US military is the top institutional polluter in the world. And it's overseas missions, it's wars basically, are among the most polluting most polluting activities. And so when you put all these things together, environmental racism, and the war against, poor people at home and abroad are intimately related. I did want to say one thing just on the Medicaid expansion piece as well. I mean, it is when these negotiations were going on to pass, whatever parts of the Build Back Better agenda that could move forward, it was really interesting that, among just talking to different people on Capitol Hill and this, that, and the other, Democratic leadership and elected officials wanted to pass, let's say, Medicaid expansion, but they would also say that this isn't an issue we can take up because it's only a couple of democratically led or states where they have an in. I mean, and the political will was so constrained, even recognizing how wrong it was, recognizing how feasible it was, recognizing how many lives it could save. There was a study that said that over 330,000 people, could have survived COVID if not for Medicaid expansion, right? If only we had universal health care. And so, I mean, this is even recognizing all of these factors, the political will is so constrained that when votes were being counted for the Inflation Reduction Act, even Democrats in Congress kind of agreed among themselves that they wouldn't vote for anything that wasn't in that limited framework that moved forward. That they couldn't actually break rank and move that forward. And so I have
something to share on that. Cover Alabama wants to close the coverage gap however we can quickly, the quickest way we can do it. We don't care if it's the federal government or the state government. And so we joined with and co-lead the Southerners for Medicaid Expansion Coalition, which is all of the Southern states that have not expanded Medicaid, the people in my job in those states, and advocated Congress to include that. And we got it passed in the House Build Back Better version, but it was Joe Manchin standing alone as the only sole opposer. And then Democrats held hands and voted alongside with him on Senator Warnock's amendment, which was voted on the floor during the Inflation Reduction Act. And that amendment failed. And it is interesting to see that amendment failed, but Susan Collins, a Republican from Maine, voted for it. So we never really needed Joe Manchin's vote anyways. But I say all that to say your votes in federal elections matter too, because we can't just hold out hope for our state elected officials. We have to vote like our lives depend on it, and for our state elected officials, but we have to vote like our lives depended on it in our federal elections too, because that was the very last thing to get negotiated out of the Build Back Better bill. After they got rid of the child tax credit, after they cut down on environmental stuff, on home health care, all of these incredibly wonderful programs, we got all the way to the Senate floor with an amendment. And we were the only legitimate kind of amendment that was offered in that process. And it was, by Senator Warnock of Georgia, a non-expansion state. So, and I will say that Congresswoman Terry Sewell has been a huge advocate for that and has spoken at many of our events and come and spoke with our coalition and has led the way on trying to get that done and Build Back Better. And, she and the Black Caucus are very, very committed if Democrats maintain the House and the Senate after November to get it done, to actually do it, to close the coverage gap, not only in Alabama, but in every state, every single state. So Texas and Florida and Mississippi, that all at once we could have universal health care really, truly overnight. And I don't think enough people understand that this decision is because states have failed not to do it. And because we didn't have a federal government that acted on it. It was like the Obama administration ended and it was the Trump administration and they didn't want to do that. And then unfortunately, Joe Manchin stood in our way. And it's very sad to me that, Democrats championed the Affordable Care Act, which had Medicaid expansion as a necessity. It was necessitated under law. It was the Supreme Court that removed that necessity for states to expand and gave them a choice. And that we didn't clean that up. We didn't actually, Democrats in Congress did not vote to fix it. But we know that that was because of Joe Manchin. So we have all the support of Congress except for Joe Manchin. So I think voting in your federal elections is incredibly important because you can isolate some of those dissenters who really have no reason to dissent other than they just have a personal feeling that they don't like it, which is what Joe Manchin's feeling was.
Well, Joe Manchin and 49 Republicans.
Yeah, that's true. 49 Republicans. Yes, that is absolutely true. Yeah, I get harsh on Democrats every now and then because I'm so upset that that this didn't happen. But it's true. It was Joe Manchin and 49 Republicans in the Senate. All of the other Democrats supported it. Yeah.
Yeah, I do think that kind of brings us around to, and Jane, you implied this when you were talking before, but that it's incumbent on us to, with every elected official we speak with, whether they're city council, county commission, state ledge, federal, it doesn't matter. This is an issue we need to bring up over and over again. And we need to bring it up with potential voters. Let's go back to the fact that we have a large number of people in this state who did not vote, who could be directly impacted by a change in Medicaid expansion. I dropped the link to the Poor People's Campaign's website, because any of you on this call that are not already on our list, please do that, because we have a big effort to try to turn out voters in November. And Callie, am I correct that you now have a new role?
Yes.
With that, you want to explain that to the group?
Yeah, so I'm accepting invitations to your part of the community to come in and help get out the vote, to do canvassing, to speak to whatever excites your community. You know your community best. Just shoot it by me and we'll show up and we'll get out and encourage people to vote, tell our stories and see just how much we have in common, not how much we don't have in common, how much we do have in common and why they need to vote. If I could carry you guys around with me, Shelly, I wouldn't have a care in the world, because I just turn my recorder on and we have those people in an instant.
I know.
I feel the same way, Callie.
I feel the same way. The three of us need to just get like a little soapbox and a pickup truck and travel around the state.
I have the human part of it. It makes it realer, but the number and the statistics. When you were giving your report, Shelly, I was getting heavier and heavier because I know it's true. Because my husband works at a cemetery. He worked the whole pandemic. The whole pandemic. He would come home and this little small cemetery, there would be 5, 10, 12 funerals in a week. You know, it was unreal. And I know this to be true. You know, we even lost Pam in Last County. I went to her service, who was a Poor People's Campaign national spokesperson, who was living with this water issue, sewage in her home, and died from the pandemic. You know, it's just not right that folks live all their life struggling and then die like that. You know, it's so unjust. And if that doesn't touch your heart, then I don't know. I'm one of those people that live from paycheck to paycheck. So everything I do, I have skin in the game. So, I'm passionate about all of it. But I also have room for other folks that are struggling just as hard as I am to try to help them understand, what it is we need to do to fight for ourselves. Because in reality, ain't nobody coming to save us. We gotta do this work ourselves. We gotta put boots on the ground, and that's why I say I'll come to your community. Just talk to people. Say, we want to talk about they who are they that's coming to save us? Them people. No, they're not coming, and we gotta make ourselves heard, or we'll be continually burying our children. We got too many other things killing us in the world for not to have healthcare insurance. Too many other things are already against us. You got to get, if nothing else, if you don't have to vote for anything else, Democratic, Republican, whoever, we're all humans. We're all family. We all want to save our loved ones. If you don't vote for anything, you gotta vote for anything else. You need to get out and vote about this health care. Because without your health, you have very little. You can't work, you can't, you know. So that I'm the human part of it because I'm living it. I had 2 heart failures during the pandemic. I was in the hospital 3 times. I had the 2 heart failures. I got fully vaccinated. Then I caught COVID. I was in the hospital with COVID. I got 3 hospital bills. One was over $220,000. One was over $30,000, and one was over $58,000 because of this healthcare thing. Where am I gonna get that from? You know, it's crazy. It's crazy that we you know, that we don't want to give people healthcare insurance. I mean, a right to have a healthy life, to nip these the breast cancer when you have a little knot, nip it in the bud. Nip it in the bud, you know, that what preventive, life sustaining, so that I wouldn't be that I still be fighting for somebody, I promise you, but I wouldn't be fighting, you know, because Venus is gone, because she would be here with me fighting too. So yeah, that's my spiel, y'all. I'm done.
We've been saying in the Poor People's Campaign that our votes aren't a show of support, there are demands. And so Medicaid, healthcare, you know, a society where we can thrive, that's a demand that poor people have to be making together at, you know, right now, because everything is on the line. And we have the numbers on our side to change it. I mean, that's the other part of it. It's like, this is not how it has to be. We know we can do better. We know what it takes, right? And so that's what we're going to be doing.
Whew. Thank y'all so much. When we opened this an hour and a half ago, I told y'all that you were going to hear some fabulous speakers, and I am sure now you know, but I wasn't lying to you. We've got lots of work to do in the state. We have lots of great people doing it, and there need to be more on board. So look in the chat, join Cover Alabama, join the Poor People's Campaign, join the League of Women Voters, talk to your neighbors, talk to people. I love the See the Gap video. Just as Jane says, people in the coverage gap in this state are all around us. We see them every day, and we have to continue to see them. Now, I know I'm nowhere near as eloquent as Callie. She always says exactly what's right to say. But thank you, all 3 of you, please, for being. Oh, and Jean Norman also said, join Alabama Arise. That's correct. We've got groups working on this, and they need more and more of us, and we need to be talking out loud every time we have the opportunity, whether it's to an elected official or to our next door neighbor. It doesn't matter. We can't be quiet. I'm going to stop.
You all can call me anytime or email me if you want me to come to an event or speak with a group or anything. Like I take, it's my passion and my life joy to do this work. So, you know, I was pleased on my trip to DC to do this, looking forward to it all day. So, yeah.
Well, we could have the Jane and Callie show. And if Shelly would just move to Alabama, we could have a
bring it there for a couple of weeks, just work our way through.
Yeah, I'm all for teamwork. I'm all for teamwork, guys. No, I don't in any way plan to do this, get out the vote work by myself. I'm looking to partner with everybody that wants to partner, and let's get this done. This is a team effort. I can't stress it more that we got to do this for ourselves. And women change the world. And any men on no offense to any men that are on this side. My husband is sitting right here. But women, we know. we change the world.
That's right.
And it's time to change it. It's time for us to do
it's time. That's right.
It's time.
Thank y'all so much. And I do want to remind people to look in the chat for the link to next week's healthcare program on the 22nd about reproductive healthcare. Thank you, Shelly, Jane, Callie, and thanks to everyone who came tonight to listen. I know you're now fired up and we can get this done.
Yes, we can.
So much. Kathy, did you
Oh,
have
yeah.
anything you wanted to add?
Well, I just wanted to say I am very humbled, and I feel like I've learned a lot, and this is just the right subject right now for us to all focus on as for the election. When vote411.org, I wanted to put a plug in for that because it's not live right now. It'll be another few weeks, but when that system goes live, which we can put a post on our Facebook page so people can see it. But Jean, the contact information for the candidates is on the Vote 411, right? So that's when you go out there, I would encourage you don't wait for a candidate forum, call them, send them an email.
That's right.
And just pick the ones that belong to you and make sure they know that you care.
Yeah.
Because that's what it's going to take.
Right.
We're working on that contact information.
Well, we
right
are.
now. Yeah.
They don't
Come
necessarily
back
put it.
soon.
Yeah, some of the candidates didn't put it in their information for when they signed up and registered to be a candidate, but we're looking for it, and we are beating the bushes. So when the system gets loaded, we'll have as much on there as we can.
Also, I just wanted to share that Cover Alabama is in the process of developing county level fact sheets. And hopefully we'll have most of them done in the next couple of weeks that we'll be emailing out to elected officials, and would be happy to share them with League of Women Voters to share out to the relevant counties. But it'll show the number of people in the coverage gap by county and some statistics about the county, including stuff like economic impact. And then in November, we're doing a webinar, Alabama Rise and Cover Alabama is doing a webinar about how to use that county fact sheet that we've developed to meet with your lawmakers on Medicaid expansion, how that county fact sheet can serve as a guide for you to do a meeting, because all of the data will be there, and we'll go over how to use the county fact sheet, connect it with talking points, and meet with your lawmaker. So, yeah.
Jane, you dropped the link to Alabama Rise in the chat, didn't you?
No, but I'll do it.
Maybe you should, because then people can sign up and get alerted about these webinars.
Yep, absolutely. And if you sign up for Cover Alabama as well, you'll be alerted about the webinar.
And I think I saw Carolyn online. I was thinking you put the Poor People's Campaign information, Dana.
I did. One of several people from the Poor People's Campaign are on tonight, and Carolyn Foster is one of the tri-chairs. So Carolyn, if you'll go on camera and wave so people know who you are, that would be fabulous. Callie, of course, is integral as well. So
let me see. I put it on speaker view. I don't know if everybody has to do that, but Carolyn, I know you're there somewhere.
There she is. I'm here. Thank you. I just turned off my light.
It's always so good to see you, Carolyn.
Wonderful. Whoops.
Is there anybody else that just want? I mean, are there other organizations that want to share their links? Drop it in the chat. All right. Well, we'll all stay connected, and if you come to next week, this is phenomenal. Thank you, Shailly. Thank you, Jane. Thank you, Callie. And thank you, Dana. And good night, everybody.
Thank you, League of Women Voters, for putting this on. This was awesome.
Thank you. This is wonderful. I love doing this. Has been great. Thank you.